There are over 1 million people in the United States that live with an amputation. As diabetes is becoming more prevalent in our society, the number of amputations are expected to rise to 3.6 million by 2050. Receiving an amputation is a traumatic and life-changing event affecting many aspects of an individual's life. Given that patients with amputation face physical and psychosocial challenges throughout the rehabilitation process, how can rehabilitation training after amputation be made more effective? Hello, my name is Brianna Davis. I would like to thank my faculty advisor, Dr. Lee, for letting me work alongside him on this project titled Visual Attention During Observational Learning of Motor Skills, Implications in Rehabilitation After Amputation. Our goal is to investigate the effectiveness of incorporating peer-based training during the post-amputation rehabilitation process. We believe that participants observing an amputee peer will have a better outcome compared to observing a non-amputee. To answer the question, how can rehabilitation training after amputation be made more effective, we did a literature review of articles. Previous studies have examined how effective peer-based training is for individuals with upper limb amputations, but little to no research has been done on individuals with amputations below the knee. A study that researched the expectations of rehabilitation following lower limb amputation illustrates how individuals with an amputation face uncertainty both before and after their procedure. And when those uncertainties arise, patients often look toward established amputees for support and guidance. A patient stated, "I would mainly like to ask people who have got artificial limbs because there's little things that come in at the side that maybe the professionals aren't aware of or do not know about." Another study found that patients help each other move towards set desired goals, it primes the brain for positive challenges and social support. Lastly, a study that found the effectiveness of evidence-based amputee rehabilitation found people with lower limb amputation receiving physical therapy are more likely to have better control of shifting their weight, better endurance, and better walking speed, as well as an increased 1-year survival rate compared with those who do not receive physical therapy. Effective rehabilitation after amputation can have a significant influence on physical function and quality of life. In this study, participants around the same age will watch videos of their peers with a similar level of amputation perform a balance task and a fall recovery test. The participants will also be watching a non-amputee perform the same balance task and fall recovery test. Visual attention and performance-based outcome measures will be tracked through the iLink 1000 Plus. The iLink 1000 Plus is a camera system that tracks eye and gaze movement. Figure 1 shows the setup of our experiment. The patient will rest their chin here and will rest their forehead here as they watch the videos that will play on this computer screen. As they are watching the videos on the computer screen, the iLink 1000 tracks their gaze movements as they are watching the video. Figure 2 is an example of a participant with a below-the-knee amputation performing the fall recovery test. The fall recovery test is when the patient is walking at a normal pace on a treadmill and is unexpectedly tripped, causing one of their legs to swing. Once fully recovered, the participant continues to walk and the process is repeated. More than 50% of individuals with lower limb amputations experience trip-related falls annually. Stimulating a trip is a method used to reduce fall risk. Figure 3 is an example of a participant performing a balance test on a stabilometer. The task is to try to keep the platform in a horizontal position. The loss of functional use of ankle muscles for below-the-knee amputees caused them to not be able to provide body support when walking, and it unstabilizes medial lateral balance. A stabilometer assesses medial lateral balance. Control. Once the participant finishes watching the videos, we will receive data back that tracks how many times the eye dwelled in a particular area. Figure 4 is an example of the data we received back. The teal circles indicate the place where the participant was gazing. The boxes isolate the bodies we're interested in. We aim to expand the understanding of motor learning in individuals with and at risk of a below-the-knee amputation. We hope this research will lead to more effective and efficient rehabilitation. The knowledge gained from this research can be beneficial for service members, veterans, and civilians with amputations. Thank you.